Welcome. This is Dr. Rockhold again, and we are in Block 12, Substance Use Disorders of Medical Neuroscience. In these sessions, we're going to be discussing drugs commonly associated with abuse. And in my material, I will be dividing the material into 4 sessions. Across those 4 sessions, we're going to describe major features of substance abuse in the United States, identify Drug Enforcement Agency controlled drug schedules and Mississippi Prescription Monitoring Program requirements that govern when and how potentially abused drugs can be dispensed. We're going to review key neuroanatomical elements of the brain reward system, and then we'll recognize primary substances for abuse and manifestations of symptoms elicited by such. What I've done here is to order alphabetically the major drugs and drug classes that are most commonly encountered in today's medical environment. You already know that substance misuse carries a substantial risk of intoxication, virtually all the agents we will discuss, and that you are likely to encounter also carry the risk of progressing into the category of substance-specific use disorders. We've all been to college. It's not rocket science to state that substance misuse is prevalent, and abused substances are readily available to many groups with whom you will interact. Obviously, I think you will not be blind to the recent changes in Mississippi legislation that will change the playing field further, at least for the cannabinoids. You should also recognize that substance misuse of prescription agents is frequent, and as a provider, you will be the target of individuals who seek access to those drugs for recreational, illicit, or illegal purposes. We'll talk a little bit about systems in place to assist with countering such individuals. You should recognize also that you, as a physician, are looked upon as a major regulator of access to drugs, like opiates, that enter the general population as prescription agents. You need to know that the substance abuse communities are fluid and always evolving. As such, staying current with drug trends can be a real challenge. One good way is to follow a multi-decade project called Monitoring the Future. Monitoring the Future is a survey-based study done by the University of Michigan, and they routinely get data from tens of thousands of 8th through 12th grade students in hundreds of United States schools. The data are published both on their website and on the National Institute of Drug Abuse website each year. I think you'll find that it provides useful data on school-age penetration into and trends of self-reported drug use across a wide variety of commonly misused drugs in school-age children. Interestingly, the 2021 data are both surprising and encouraging. For the first time in over a decade, overall use of illicit drugs has fallen in all 3 age groups surveyed. It's possible that there are some positive features to the COVID pandemic that we have not fully appreciated. Unfortunately, that was the good news. Overriding that is the fact that there were an estimated 100,000 drug overdose deaths in the United States during the 12-month period ending in April 2021. That's an increase of almost 30% from the same period a year before. The overdose deaths from synthetic opioids, primarily fentanyl and its congeners, and the psychostimulants such as methamphetamine also increased in the 12-month period ending in April 21. Cocaine deaths, deaths from natural and semi-synthetic opioids such as prescription pain medications also increased during that period. And the graph here simply illustrates just how dramatically those overdose deaths have accelerated in this last 12-month period. As you're learning in this topic block, drug misuse is a complicated situation. It can be tragic in its outcomes. The slide here is simply to point you to a case report from 1992. It's pretty brief, that illustrates a rather unusual story of drug abuse of an over-the-counter medication, and which I think helps to illustrate the impact that can be manifested on an individual. The primary drug likely to drive this individual's drug-seeking behavior is the cough suppressant dextromethorphan. The link will take you to the National Library of Medicine citation, where you can download the full report if you're interested. In the opiate lectures, I introduced dextromethorphan as an atypical agent. Despite reports such as the one that we reviewed in the previous slide, dextromethorphan, as of September 10th, 2010, is not scheduled by the Drug Enforcement Agency. It remains available in over-the-counter cold medications and as lozenges, indicated for use as an antitussive, although there is a real question about its efficacy as a cough suppressant. For now, let's just recognize that even over-the-counter commercial substances like dextromethorphan have significant potential to drive substance misuse. Dextromethorphan itself has a very complicated pharmacology, including both antagonistic actions at monoaminergic, glutamatergic, and cholinergic receptors, and can stimulate a distant cousin of the opiate receptors called the sigma-1 receptors. It does not produce any measurable analgesia. Now, while it has abuse potential, it usually requires excessive dosing to get to levels that drive such behavior, as in the case report in which the patient was consuming somewhere around a pint of the cold medication daily. I've included this slide to remind you of the major elements of the brain reward pathway that is considered to be the primary target for a variety of abused drugs. The image. So, to summarize this section, as a provider, you need to maintain an ongoing understanding of current trends in substance misuse, not in the least because increasingly you have the responsibility of influencing patterns of misuse, and you are the target of enforcement activities. And finally, for the first time in many years, I can modify my traditional welcome to matriculating students at UMMC. Marijuana, at least as medical marijuana, will no longer be illegal in this state. Obviously, you'll need to become aware of the regulatory controls that are developing over prescriptions for medical marijuana. I want to thank you for your attention. Please stay tuned to the other 3 sessions in this group of lectures.